A triceps tendon rupture is not a common elbow injury, but it's one that requires surgery and a long period of recovery. In this video, I'll discuss how it occurs and what the surgery and recovery process entail. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, a triceps tendon rupture is fairly self-explanatory. You know the tricep is the big muscle on the back of your arm. Looking at my model of the elbow, it attaches to this bony tip of the elbow called the olecranon. And what it does is the triceps helps you straighten out your elbow, basically. And rupturing that tendon, not the muscle back here, but the tendon as it attaches to the olecranon, almost always needs surgery to reattach it to that olecranon, to that bony process. I would assume if there was a small partial tear, you might be able to treat that without surgery, but the vast majority of these are ones that the tendon pulls a piece of bone off or it completely ruptures off of that bone, requiring surgery. That won't heal on its own and reattach and give you full strength. Typically, this is some sort of sports or exercise movement, a sudden force of the arm out against weight, potentially landing on it in theory could happen. So you see it sometimes in American football. But again, it's a traumatic event. It's not something that comes on over a period of time. Surgery is pretty straightforward through either stitches or maybe suture anchors. You basically reattach the tendon to bone and then you wait for that to heal. The recovery process is long though because you have to protect that repair. So you'll likely be in a splint or an elbow brace, and then gradually the surgeon lets you do more and more motion while allowing that repair to heal. At a certain point, you get to start strengthening exercises and then work towards full recovery. That process, though, in terms of being as good as you were in terms of sports or exercise or at the same or higher level, can be 6 months, it can be 9 or 12 months, depending on what it is you're trying to go back to do. Daily activities and all might be a little bit quicker, but you have to get that repair to heal and then work on range of motion and strength. And the elbow is a notoriously tough joint to get range of motion back. So it's a lot of work, a lot of time with physical therapy, a lot of exercises that you do on your own working to get that back. As far as newer treatments, people ask a lot about BPC 157 and is that something that might help a tendon heal. That has been looked at actually for tendon injuries in animals. I'm not aware of any studies in humans, and not for the triceps tendon, but looking at it for the Achilles tendon in animals, and I think it was rats. It did seem to help the Achilles tendons heal. Obviously, peptides are something that are considered experimental by the FDA. I'm not endorsing them or anything like that. If you ask me, is it possible that it might help? I would say you would still need surgery, but it might help the tendon and the surgical repair heal and get somebody back to full strength and full activities a little bit faster. I'd love to hear your experience with your elbow injury. Leave those in the comments below. Just understand, I can't give you specific medical advice if you leave a comment in the questions. What I can do though, if you discuss or leave a question, is discuss that topic on a future video on my stream. So make sure to subscribe to my channel, click the bell to be notified when I release a new video, including my live streams, my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.